Well, good morning, everyone. I think you've heard the really excellent presentations of the Chair of the Board of Health, Joe Cressy, former Minister of Health, Helena Jacek. I'm pleased to be here. I used to be the Chair of the Board of Health in the City of Toronto, and I can only say that I've been horrified by the cuts that were put forward by the Ford government. I think that they need to be withdrawn. I think the arguments that are made about the risk to human health and the risk to communities across Ontario are entirely accurate. Now is the time for Doug Ford as Premier to talk to his Minister of Health and say, we went too far on this, we need to pull back. If we're going to deal with costs and efficiencies over time, let's sit down and meet with the municipalities, meet with the boards of health, and determine a way forward.
We had the FAO report yesterday that what appears to be in part driving some of these savings or efficiencies or cuts or whatever you want to call them are these unannounced measures in the budget, which appear to be tax cuts. Do you think that's what's happening here, that the government is cutting now so that they can do tax cuts right before an election campaign?
Well, I think that's an entirely reasonable guess as to what's going to happen. I think that you've got a government that is not thinking about the impact of those cuts. Surely, if you're interested in efficiency, you're interested in keeping people out of hospitals. You're interested in avoiding mass outbreaks of disease. So if you're actually interested in efficiency, you wouldn't be cutting here. But it has been suggested by others that their cuts are being put in place to pay for other measures that the government is considering, perhaps breaking contract with Brewers Retail. Mayor Tory has suggested that that's what's driving this. In the end, I don't know which initiative is driving it, but I think it's very clear that the outcome of these initiatives is putting people's lives at risk. And I think Chair Cressy talking about the situation in Toronto was correct. You push the risk far enough, people will die. And that's what we're dealing with here.
You were at the City of Toronto. Aren't they likely to pick up the gap? It's very hard to imagine the city would sort of forego funding these initiatives.
I can't say exactly where things will come down there. Even when I was the chair, we had some pretty heavy-duty battles to get public health funded. But it was clear after SARS that the investment in public health from municipalities was not as much as it needed to be. Actually, during the SARS outbreak, I had an opportunity to talk to friends who were working for the Toronto Board of Health. And it was clear from their experience that things could have broken down in that fight against SARS. There just were not enough resources to cope with it. If one or two other things had gone wrong, we would have had a far more dangerous situation in Toronto. So I'm not going to assume that the City of Toronto will pick up the balance, but I would say that after SARS, after the understanding of how a shortfall in funding puts people's lives at risk, the recommendation was very clear. The province has to increase its funding to public health. Withdrawing the funding right now puts people at risk. There is not an assurance the City of Toronto will pick it up. Any other questions? Thank you very much.